Hey guys, welcome back to the show today. And today I want to break down the difference between physical therapy and the stretch method. And here are some basic descriptions of physical therapy. So, physical therapy promotes restoring and maintaining physical function and mobility in individuals of all ages. Physical therapy uses a combination of hands on techniques, exercises, and modalities to help patients. Key here is patients recover from injury, surgery, or medical conditions that affect their ability to move and function effectively. Now, the goal of physical therapy is to increase strength, flexibility, balance, coordination, and to improve a person's or patient's quality of life while they reduce pain and prevent future injuries. Now, they're going to use terms like rehab, rehabilitation, prehabilitation. Rehabilitation refers to reducing pain, and prehabilitation is kind of vague at this point, but it is meant to improve strength. When we discuss the role of physical therapy and then we relate it to the stretch method, it is important to also include services like athletic training, personal training, and fitness, so that you can see the bigger picture of where there is a lane that is underserved. Now, athletic training focuses care on sports-related injuries and prevention, with the goal of their care being keeping our sports players strong. And these athletic trainers, along with fitness practitioners and personal trainers, are all working to offer strength and conditioning programs. Now, these programs do well for populations that have a healthy neuromuscular system, but typically fall short. And all of these services combined are not enough to keep our population strong and keep them away from surgery. In this episode, I'm going to seek to help you see the difference in physical therapy and in the stretch method. The stretch method is a specialized approach to treatment from pain and tightness. And this methodology stems from the roots of physical therapy, but combines holistic healing and a proven reconditioning program using a preventative health and wellness whole body approach to reversing pain and tightness. So notice we're talking about a reversal and not just a decrease in pain, but a reversal of pain and tightness. Let me dig in a little deeper here. Stretch method looks at testing and treatment differently than all other services available today. Now, I established this health and wellness whole body baseline testing and treatment program to focus my care on restoring the neuromusculoskeletal system to a more healthy state. And usually people suffering from pain and tightness are the ones that are seeking care from the stretch method. And I'll talk about the people that can provide the stretch method. Now, this methodology is a preventative model of care, and it provides testing to find signs of unhealthy movement patterns. And a stretch mobility coach is trained to offer the stretch method to solve these movement problems for people that experience pain and tightness and are looking to find the root cause of their problem so that they can live a life without limits. Now, notice here we're not talking about decreasing pain so that you can play a sport. And we're not talking about recovering from a surgery or restoring strength to what it was like before an injury. We are talking about restoring and reconditioning damage that has been done. And I'm going to talk a little bit about what causes that damage here in just a minute. The stretch method is a multifaceted treatment approach and preventative testing program that restores healthy joint mobility. It reconditions muscles that have been damaged through an active deconditioning cycle. Now, people get into a deconditioning cycle due to age, due to disuse, due to injury, as well as diseased processes. And the stretch methodology is a longer-term program that is backed by science and seeks to break that deconditioning cycle that leads to chronic pain, disease, degeneration, and more. Guys, we're just touching the surface of what problems are being caused by this deconditioning cycle. And this methodology was created because our current physical therapy, chiro, personal trainer, fitness, and sports treatments provided rehabilitative care, strength, and conditioning programs. But we still have a missing gap that is not helping people stay away from surgery. And I found that these programs alone did not provide the results that people were looking for. And if we collaborated, all of us, physical therapists, personal trainers, chiropractors, fitness experts, if we collaborated and stayed in our lane with what we did, we would be able to offer people a complete solution that would keep them away from surgery. And I found that in my clinic in Westchester, Ohio, when I initially opened my PT clinic, and then I transitioned it to the Stretch Mobility Coach in 2020, when I found that there was a complete disconnect, guys, there was a gap that was needed to be fixed. And I bridged that gap so that I could collaborate care between all of these systems that we already have that are awesome, so that I could provide true preventative care. Now, the difference in PT and the stretch method is very clear. Our lane as PTAs is to be able to provide treatment, but we've not been taught how to provide testing. If PT is rehabilitative or prehabilitative, and athletic training and personal training and other services are to improve flexibility and condition muscles through strength training, we're still missing the effects of what is caused by the deconditioning cycle. So if our population goes to PT and PT just restores and decreases pain, then that deconditioning cycle is not broken. If athletic trainers and personal trainers are working to provide conditioning programs that help build strength and help improve flexibility, they don't break the deconditioning cycle. Chiropractic care improves joint mobility over time and totally improves the nervous system, but it does not break that deconditioning cycle. The stretch method focuses care to break that deconditioning cycle, then to work on reconditioning muscles, joints, and the nervous system that has been damaged through that cycle. The stretch methodology approach looks at testing and treatment differently. We're going to use a whole body approach that is holistic, that restores the neuromuscular system to a more healthy state so that you can be successful in returning your clients to strength and conditioning programs. Now, I train PTAs to become certified stretch mobility coaches, and nobody else can get in this program. You have to have a license and have to be a licensed physical therapist assistant to apply to become a certified stretch mobility coach. When you do this and you're accepted into my program, you have the ability to now go solo without a PT so that you can help people in the same way that I have in my Westchester clinic. Now, if you're a PTA and you're licensed and you're interested in learning more about the stretch method, I'll place a link in the show notes below so that you can schedule a coaching call with me. Now, that coaching call is only going to be about 15 minutes unless you need a little bit more, but I can provide you 15 minutes for free. And I'm excited to share the stretch method treatment methodology with you. Go ahead and click that link below and schedule your free coaching call, and I will see you soon.